stress, as you've heard, and traumatic brain injury. We are now doing research finding out that post-traumatic stress is actually a brain injury. We actually have pathways that have been damaged by the blast injuries, primarily the improvised explosive devices, or IEDs, the signature weapon of Iraq and Afghanistan. And it is estimated that 12,000 of our young men and women have TBI here in Ohio. What is the problem with an untreated traumatic brain injury? An untreated traumatic brain injury has the most fast spiral downward of any injury that we can have. And I'm sure that John would agree with this too in occupational medicine practice. Somebody said, well, it's kind of like a spool of yarn that's unraveling. I said, if you have a TBI, it's kind of like the cat grabs the spool of yarn and goes tearing down the stairs and out the door, because in 15 weeks, an untreated traumatic brain injury can be on the streets as a homeless person. In Vietnam, it took 7 years before somebody became homeless. In Iraq and Afghanistan, these veterans are becoming homeless in 15 weeks. And some of the reasons are the fact that there is 22% unemployment in the state of Ohio among our veterans. It's about 10–11% in the non-veteran population, but 22% in the veteran population. We have incarcerations because of the fact that these young men and women who have multiple deployments in a war zone, where they have to stay awake, stay alive, 24/7, 365, and in 36 hours they're dropped back into Dublin, Ohio, or Worthington, Ohio, and say, okay, soldier, you're back home. Don't worry when you're driving down the street, there's no IEDs here. Don't worry that somebody is behind you, they're not going to harm you. You cannot turn that off in 36 hours. And I had to laugh because the last question on the questionnaire at the VA was, do you feel different than you did before you went to war? And I sat there and I said, you know, I would never ask that question in my private practice, because it's skewed to make you say, yeah, I'm different. And I said to this one little gentleman, about my 5th patient that I saw, I said, if you went to Disney World for a year, don't you think that you'd come back differently? And he turned to me and says, well, Doc, I think I'd be goofy. And I thought that was, and it had what I call the military smile, which is just a little curl of the lip. You know, you don't get that full-blown smile. But it's really true. One of the things that I know that you all are movers and shakers, and we've got a lawyer of the year here, you know, what we need to do is to change the way that we are treating our veterans when they return from a war zone. They are survivors. They should not walk into a Veterans Administration hospital referred to only by the last 4 digits of their Social Security number. Nobody thanks them for their service. Nobody calls them by their rank. Nobody mentions their name. That is the first thing that we need to do. We don't treat them as survivors. We tell them that they're victims. They're damaged. And if you want to be treated in our system, you have to prove to us time and time again how damaged you are. And the more damaged you are, the more we'll pay you. If you're a rehab physician and you walk into that system, every single hair on my body stood up and said, this is not a healing environment.